is that this solutions actually can be used to help actually normalize the function of the GI tract. And it's although they can help with providing some substrates to help the animal heal, the main part of microenteronutrition is really in the mechanisms of actually trying to modulate function. And so it's important to recognize that the expectation is not that microenteronutrition will meet the nutritional needs, but remember that it's not its main purpose. And so one of the things that we like to think about is using microenteronutrition as the first step so that animals that can tolerate microentero can then be transitioned to more appropriate diets. The advantages of having this approach is that the solutions are very easily absorbed. It's also not dependent on cellular surface enzymes for absorption. These solutions are typically high in fat. They also do not delay gastric emptying because one of the things about fat is that when the body senses that there's fat in the stomach, it realizes that it needs to secrete pancreatic secretions to help digest and to assimilate. So bile salts are secreted, bile acids are secreted. But when there's now fat in the diet, it actually speeds up motility. So therefore, there's not this residual volume of fluid in the stomach, and it can actually go to the intestines. And therefore, these solutions are not really relying on normal GI motility. Therefore, these solutions have a higher chance of being tolerated by an animal. In terms of how should we do this, and clear guidelines are still not established, but a sensible approach is to start about half a meal to 2 meals per kilo per hour, and then you evaluate the patient for tolerance. So, is the patient able to receive these solutions without having regurgitation or vomiting? Once the animal is tolerating, and this can be assessed in 4 to 6 hours after starting, you can potentially increase it to 3 mLs per kilogram per hour. And after 24 to 48 hours, if these are well received by the animal, then you can transition them from these microenter solutions to actually full liquid feeds. And so really this is what we're trying to discuss today is that although gastrointestinal dysfunction is common and a common feature of critical illness, there are ways that we can help patients with them. So obviously there's symptomatic treatment strategies that can treat the nausea, the GI sort of dysmotility. But one of the very important strategies is nutritional support. And not only because you are helping animals have the substrates and the energy to heal, but also because it in itself can help modulate gastrointestinal function. And as far as we know, enteral feeding is the best approach in most cases with gastrointestinal dysfunction. For many cases, the first step might be to actually use a microenteral nutrition approach, although others can benefit straight into a full sort of balanced nutritional feed. And then the next step would be to transition animals using our ability to monitor their response, then transition them to actual full enteral feeding. And with that, really, I think we covered a lot of what we have to think about as the best way in treating patients with gastrointestinal dysfunction in the setting of critical care. So thank you for listening, and hopefully this has helped sort of formalize your thinking about how we can help patients with critical illness. Thank you very much.